A new year often means a fresh start, and that includes health and wellness goals. But old healthcare issues could be standing in your way. Dr. Natalie Gentile with Direct Care Physicians of Pittsburgh joins us now to talk more about what many people call a broken system. I'm so glad we're here talking about this.
One of my favorite topics again, Heather.
I know, well, this is really, I think it impacts so many of us because we all have different insurance plans. We all have different insurance companies. We're working under different circumstances, and so things can vary from patient to patient.
And the average person is not going to be able to keep track of those changes year to year in their plan within the different insurance companies. So because of that unpredictability and the ambiguity of it, people are really at the will of their employer a lot of times, which is where they get their insurance through.
Well, even something like this, I saw a story that just came out, I think over the weekend. This woman was on Ozempic for all the right reasons and had finally lost some weight and was in that healthy blood sugar range. And then her insurance company said, well, we're not going to pay for the Ozempic anymore. So, you know, even things like that, you think that you're doing the right thing, and now all of a sudden, because you're doing the right thing, you're losing the thing you need.
Prescription drugs in particular are a big question mark when it comes, you know, between insurance plans and patients, and that's shifting. It seems like month to month. You know, you may be able to use this one pharmacy this month, but your insurance plan might change the following month, you know, et cetera.
Well, and as a doctor yourself, does that impact the relationship that you have, or does it strengthen the relationship that you have with your patient? Because there has to be a lot of communication.
So I'd say it strengthens the relationship in my practice because there is nothing between me and my patients, right? Like I directly contract with my patients, so we're kind of in this together. When these prior authorizations come up, for example, or these big question marks come up. But I'd say in the big systems, it is driving a big gap between doctors and patients because you feel even more distanced when these questions aren't answered around the things that are covered and not covered.
Well, especially if your doctor is telling you, you need this, I'm going to give you this prescription, or I'm going to run this test only later to find out it's not covered. And
there's
now
no
you
way
have
for
this huge bill.
Well, yeah, and there's no way for the doctor to predict that, right? So then where's the follow-up down the line? It's a huge burden.
It's all these things working almost against each other, not with each other.
Yes.
Right?
Absolutely.
So how do you build trust? I mean, you mentioned personally you have this direct relationship, but how can you build trust with your own doctor under these circumstances?
We need more communication. So there needs to be the ability to directly talk with your patient more freely. In the big systems, you know, there's so many people between you as the patient and your doctor. You send a message, I never heard back, right? You send a message, I heard from someone on the team. But really, in the end, it's the doctor who's made those decisions on what your plan of care is. And they need to be able to talk back with the patient and say, you know what, insurance won't cover it, let's come up with another option. It's just that right now the system's so big and bloated that it makes it challenging for that communication.
Well, and you know, we've been doing this for so long now, you know, the way that it's been operating for so long now. So is there a better way? Is there a better way to do this?
So, I mean, I practice as an old school family doc, right? Like with that direct relationship with my patients, I'm able to make things move more quickly. Right. And so what has happened with the system becoming so big, so overwhelmed, and with these connections between healthcare providers and health insurance companies, right? They're all working together. And this can be really challenging because where is the conflict of interest in all of that? So what I have done is I've removed myself from that model, right? I've removed myself from that to kind of go back to the way it used to be, where the doctor and patient work together as a team.
Old school family doc, as you mentioned, which is really neat because I don't think that we're seeing as much of that anymore. As a patient, if you want to advocate for yourself, how do you do that? How do you have those talks with your doctor? Okay, you want this test run. Is that covered by my insurance? What do I do next?
So my answer is not going to be fun. I'm sorry in advance. I think most often when the patient can directly call their insurance company and check in around what will be covered, right? And get that information themselves, that's probably gonna be our quickest thing because otherwise you've got doctors' offices that are very overwhelmed making hundreds of phone calls a day to these insurance companies, you know? I'm
gonna just speak from experience too. I remember when I was getting ready to have my first, I wasn't sure about if a pump would be covered for breastfeeding. And I called the insurance company and they said, well, here's a list of places that you can buy one and maybe get reimbursed later, like you can submit for reimbursement. And then I got to the hospital and they gave me a pump and said it was covered by my insurance. So it was all like, there were mixed messages, there was no clear-cut answer. And I feel like, to me, it summed up how things work sometimes.
Very much. It's just so disconnected.
Right. So what can people do differently, and talk about direct care doctors.
Yeah, so direct primary care is a membership-based model. So basically you are contracting with your physician. You pay a monthly membership and you have full access.
And we're seeing more of this, right? All over the country.
All over the country. It's been around for a long time, but it's really a growing movement because I'll tell you what, physicians are fed up.
Yeah.
We don't want to be in that type of system anymore.
Because doctors, too, are answering to the big systems and to insurance companies and all of that.
When patients are upset, a lot of times it's not the doctor's fault what went wrong, it's the system.
Right.
You know, and so doctors don't want to be part of that anymore. We didn't go into significant amounts of debt through our medical training and lose our 20s, you know, to all of this education just to be part of like a cog in the wheel. You know, I think that's why we're moving toward this type of model where we can get back our power in medicine and bring back the power of the doctor-patient relationship.
It's so interesting. And again, I've been reading about it popping up all over the country, so it's really, really interesting.
Yes.
Dr. Gentile, thank you so much as always. And if you're interested in learning more about direct care physicians of Pittsburgh, we'll have more information on our website. We'll be right back after this.